I'm fortunate to be one of thousands of medical students who graduated from the Howard University College of Medicine who were impacted by the outstanding teacher, master surgeon, humanist that is Dr. LaSalle D. Leffall. Dr. Leffall was born in 1930 in Quincy, Florida, and out of modest beginnings in the segregated South grew a richness of instruction that he and his sister would receive from their parents, who were both teachers. He went to Florida A&M College, FAMC, later to become known as FAMU, at the age of 15. Dr. Leffall entered the Howard University College of Medicine at the age of 18 and graduated just shortly after his 22nd birthday. Could you tell us a little bit about the inspirations, the events or the heroes that prompted you to go into surgery in general and cancer surgery in particular?
Very well. When I came to the Howard University College of Medicine in September 1948, Dr. Charles Richard Drew was chairman of the Department of Surgery. And I'd heard so much about him and what he had done in surgery, what he had done in research as far as blood and plasma preservation. And having heard so much about him and his leadership in surgery, his leadership at the Department of Surgery here at Howard, I said, I want to be a surgeon. I want to become a surgeon.
On March 31st, 1950, Dr. Leffall was a sophomore medical student attending the last lecture that Dr. Drew would ever give.
Students don't have class at Howard on Saturday night, the medical school, but when I was a second-year student, we had class on Saturday. And I can remember very well we were having class in the medical school. Dr. Walter Booker, professor of pharmacology, was lecturing to us. And I used to always sit on the front row because I didn't want to miss anything. I'm sitting on the front just writing all these notes. And a person came in, I think it was somebody we call Long Tall Miller. Miller was about 6'4", that was Long Tall Miller, a laboratory technician in the Department of Pharmacology. And he whispered something to Dr. Booker. I couldn't hear what he said. I'm on the front row, but I still couldn't hear what he said. But Dr. Booker's face turned ashen. And he then turned to Miller and said this, "You shouldn't joke like that on April Fool's Day." And I can always remember that because it was April 1st, 1950. I was a sophomore medical student. He said, "You shouldn't joke like that on April Fool's Day." And what did Miller say? He said, "Oh, I wouldn't joke like that." In other words, you might think about saying something about you left the lights on and all that, but you're not going to say the chief of surgery was killed in an automobile accident. So Dr. Booker then turned to us and said, "I have some very sad news for you. Our chief of surgery was just killed in a tragic automobile accident just outside Burlington, North Carolina, on his way to a medical surgical meeting in Tuskegee, Alabama. Class is dismissed."
And after that, one of the men he had trained, Dr. Jack White, had gone to Memorial Sloan Kettering Cancer Center for his training in surgical oncology. And that was related to the fact that Dr. Drew knew the men who were in charge of the program at Memorial Sloan Kettering Cancer Center. Then when Dr. White came back, he talked so much about surgical oncology and what he had learned at Memorial Sloan Kettering Cancer Center. I then said, well, I want to do that. Then Dr. White arranged for me to go to Memorial Sloan Kettering Cancer Center from 1957, July 1957 to December 1959. Another surgeon I'd like to mention is Dr. Burke Mickey FACS, who was called Master of the Abdomen. He was a great diagnostician and a great technical surgeon. And I think about the men whom I knew who had taught me so much. The three people in surgery, Dr. Drew, Dr. FACS, Dr. White, but there's one other, my professor of anatomy, Dr. W. Montague Cobb, professor and head of the Department of Anatomy. I learned so much from him. Those four people were my heroes in the College of Medicine. We were advised as medical students to read a book called Equanimitas by Sir William Osler. And that's why today my favorite quotation is equanimity under duress, which means maintaining that degree of calmness or tranquility that will allow you to do what's appropriate in any circumstance.
Because of your work, you're well known, obviously, in our profession, through the college, through various surgical societies, but one is as likely to see you with presidents and former presidents, with dignitaries from across the spectrum.
There's one president I got to know quite well, and that's President Bush, George Herbert Walker Bush. He worked with us on a program at MD Anderson Cancer Center. The cure rate for leukemia in the early 1950s was 20 to 25%. Now, in 1998, it's 70 to 75%. Great progress has been made, and with your help, we believe we can continue to make progress. And they were very active in something we call the National Dialogue on Cancer, or C-Change.
Could you touch on some of the things you had to deal with as it relates to prevention?
One of the main things that I had to deal with was something called cancer health disparities. Despite the increased incidence of cancer in African Americans and Hispanics, so often they could not get into the system, could not have a diagnosis made, could not be treated. That was something we had to deal with. And as a member who was very active with the American Cancer Society, the society sponsored the first conference on the challenge of cancer in Black Americans. We also included other ethnic groups where there was a cancer health disparity, and we want to be absolutely certain that all persons, men, women, children, receive the very best care in terms of diagnosis and treatment. So that's been a major problem.
When one takes a walk down the hallway that connects the Howard University Hospital with the Howard University College of Medicine, you have the opportunity to walk by the sequential photographs of graduating med school classes ranging all the way back into the 1920s. You'll notice that starting from the early 1960s, when Dr. Leffall joined the faculty, going forward to nearly 50 years, Dr. Leffall is virtually a perennial honoree among the very few honored faculty that are named by each graduating class. Indeed, it's remarkable to note that there are parents and their children who are graduates of Howard University College of Medicine who are both members of classes that honored Dr. Leffall. A span of teaching excellence that is unmatched in the history of the Howard University College of Medicine.
Dr. Drew had a famous statement that he would make, particularly when he spoke to students. He said, "Excellence of performance will transcend artificial barriers created by man." I never forgot that. What he was saying is, if you do it well enough, people have got to notice it.